Hello, my name is Dr. Anita Nagadi. I am a consultant radiologist with the Manipal Hospital's radiology group. I'm here to talk to you about an increasingly common condition, colorectal cancer. Colorectal cancer is an abnormal growth of cells within the large bowel. This can occur at any age, but certain people have a tendency to develop these in families, and certain individuals run the risk of developing this condition at a very young age. The diagnosis of colorectal cancer is commonly made when a patient undergoes a colonoscopy. This may also be incidentally picked up in patients attending the radiology department for scans such as ultrasound and CT. Once a diagnosis of colorectal cancer has been made, imaging plays a very important role in the initial assessment as well as in the further management of these patients. The imaging modalities that are commonly undertaken include CT and MRI. For a CT, the patient is required to lie within a scanner and an intravenous dye is administered through a cannula in the arm. The CT scan usually covers the chest, abdomen and pelvis, and this helps us intricately map the extent of disease, i.e. the spread of disease into various important organs such as the liver, the lungs and the bony skeleton. An MRI is commonly undertaken in patients who have rectal cancer. For an MRI, the patient is required to lie within the scanner for about 30 to 40 minutes, and various scans are performed in various planes. Once these images have been obtained, these are intricately studied and the extent of disease is mapped so that an overall stage of the disease can be arrived at. With the help of the MRI, we are able to determine the exact location, the extent of the disease, and the extent of tumor spread into or beyond the rectal walls into adjacent organs. Also, spread into the adjacent lymph nodes can also be intricately mapped. Once these images have been obtained, an overall staging is then prepared and delivered on the report. These images also serve as a very good anatomical roadmap for surgical planning for the future. Now, based on the stage of the disease, the patient may either undergo surgery or they may undergo surgery following initial treatment with chemoradiotherapy. Although CT and MRI are the common modalities that are used to stage the disease, PET CTs may be occasionally used, particularly in conditions where the disease has already spread to various other organs or where extensive surgery is being planned. Once definitive treatment has been performed, there may be a requirement to further follow up these patients, commonly with CT, for up to a period of 5 years to ensure that there is no disease recurrence. We at Manipal Hospital's radiology group strive to provide the best possible outcomes for our patients. With this aim in mind, we deliver all our reports based on a template-based reporting and use globally accepted lexicon and globally accepted guidelines in delivering our reports. Our scans and reports are also discussed in the hospital-wide tumor board, which is attended by the treating surgeons, the treating oncologists, and the pathologists. Thus, radiology plays a very important role both in the initial assessment as well as in the future management of these patients with colorectal cancer. Thank you.